To Burkina Faso next, where there's now scientific proof that listening to the radio can make people healthier. A 3-year project aimed at educating and informing parents about the health of their children has had a huge effect, according to research published in the British Medical Journal. Our global health correspondent Smita Mundasad has been listening in.
Good morning, teacher.
Good morning, children. Today we are going to study animals. What is the most dangerous animal in the world?
An elephant?
No.
A lion?
No, children, is a small animal that can fly and goes bzzz.
The answer, in case you're wondering, is the mosquito. This radio piece was just one of 150 different messages broadcast on 7 local radio stations in rural Burkina Faso as part of a huge scientific trial. The messages warned people to look out for signs of malaria, diarrhoea and pneumonia, 3 of the biggest killers of children under 5 in the country. Roy Head is CEO of Development Media International, the organisation that led the project.
If you're the Minister of Health of a typical African country and you have $30 to $40 per head of population to spend on health, you're literally deciding who lives and who dies. And so anything that you spend your money on has to be proven. And this has not been proven until now. It's simply never been proven that mass media can change behaviours, let alone save lives.
One child whose father says is still alive thanks to the campaign is Marietta. In her village, she's now called the child of the radio. When she was just 1, she developed a high fever and became unwell. The family thought she'd fallen under a curse, as Marietta's father explains.
I
consulted traditional healers and spent most of my money on traditional remedies and medicine bought at the market, but nothing worked. And on the 6th day, she fell into a coma.
That's when Marietta's father says he heard the radio campaign and rushed his little girl to a clinic for malaria treatment. In the first year, the number of children like Marietta seen in clinics for malaria rose by 56% in the areas the campaign was broadcast when compared to areas where it was not. And consultations for diarrhoea and pneumonia went up too. And while researchers can't prove this directly, they estimate through computer modelling that the campaign saved 3,000 lives. Dr. Jennifer Sheehy-Skeffington is an assistant professor of social psychology at the London School of Economics and Political Science.
I think what surprised me the most was how big the change in behaviour was. People were increasing by a huge amount their likelihood of going to get these symptoms checked out. And even though that change in behaviour diminished a little bit over the course of the study, it was still quite sizable even after 3 years.
She thinks part of the success was because researchers didn't just rely on one-way communication. Instead, they used regular interactive shows so people could call in with their questions and concerns.
They've done a lot of local research in the population to understand why are people doing what they're doing, and then they've also worked with local people in developing scripts and dramas and stories that are really engaging and get people's emotions going and make it much more likely that people are going to behave based on listening, as opposed to just thinking that it's information given to them from some expert.
That report there from our global health correspondent Smita Mundasad, listening in on whether radio can change behaviours in Burkina Faso and, in consequence, can make people healthier.